Good evening. My name is John Leopold. I'm your county supervisor, and I want to welcome you this evening to our first town hall via Zoom. Tonight we have some really great guests to talk about what's happening in our COVID response. I just thought I'd tell you a couple different things that are going on, just so you know. I'm happy to talk about those as well. The Board of Supervisors took time at our meeting this past Tuesday to recognize Ben Kelly. He's the Pleasure Point resident who was tragically killed in a surfing accident just about 10 days ago. Tomorrow would have been his 27th birthday, and so we declared it Ben Kelly Day to honor his contributions both as a business owner, as someone very involved in his faith community, and just someone who created great surfboards and was a great presence in Pleasure Point. In addition, for people who are down at Pleasure Point, they might notice that there is a new mural that's going up on the bathroom building right at the point. This is was funded by Friends of Tushar Arte, the man who was killed from Pleasure Point earlier this year. You might have heard that the sheriff recently made an arrest of 4 individuals. He'll be having a press conference either tomorrow or Friday to provide more information about that. But we'll have information and we'll have a memorial to this man that will help brighten a building that is pretty boring right now. Lastly, tomorrow the Community Advisory Group in Soquel will be meeting. This is the group that was formed in response to the creation of the temporary housing that we're providing to transition age youth at the 7-Day Adventist site. That group will be meeting tomorrow for the first time, and I expect that next Wednesday at this time, we will be having a community meeting that everyone will be invited to with the Community Advisory Group to talk about what that group's going to be working on to make sure that we address all the concerns identified by the community. And I hope you'll join me then. We'll be sending out information about how to get on that Zoom call very soon. Tonight, we're going to be talking about the county's COVID response. As you know, the county took early action, and the results that we have seen have been very promising. We have a very low case count. We've been fortunate that not too many people have died. And at this point, we are working to strengthen our public health infrastructure to make sure that we can coexist with COVID and not just be sheltering in place the whole time. We're working very hard to follow good public health guidelines, and tonight you'll be talking to 3 key members of our team that are leading our Save Lives Santa Cruz County effort. Tonight joining us will be Jen Herrera, who's our Chief Public Health Officer. Jen is also leading the Operations Center, the Department Operations Center for COVID, and has been very involved in our COVID response. Also, we have Mimi Hall, who's the director of our Health Services Agency and been a key architect of our COVID-19 response. And introducing you tonight to Margaret Lapiz. Margaret is new to the county, but not new to healthcare. She is part of our Saves Lives Santa Cruz County effort, a partnership with the Community Foundation of Santa Cruz County, who graciously provided the funds for Margaret to work with us and lead our testing and recovery group within the health services agencies. She's going to be talking tonight about testing. But I want to give a chance for them to talk. But in this new format, I just wanted to let you know that we're using a Q&A function. If you look at the bottom of your screen, there is a little thing that says Q&A. You can click on that and write questions to us that we will see and we'll work to answer. Most of them we'll answer tonight, and if we can't, we can also answer them electronically, and they'll also be posted there. Also, you can see us, but we can't see you. You're muted, so we won't be able to hear you. But if you write your question in the Q&A, we'll do our best to answer each and every question, and those that we can't get to, we'll try to respond either on Facebook or another way. If you want your question directed to an individual, whether it be me or one of the talented professionals that are here with me, you can write that name. So if you want John to answer, you could say, John, tell me about whatever it is you care about, or I want to ask you a question about that. And we'll try to have that person answer it. And if they could be helped by someone else here, we will. So thank you for participating in this first town hall via Zoom. And I look forward to a great discussion this evening. First up is Jen Herrera. Jen is our Chief Public Health Officer. She's been involved with lots of different things. She's going to tell you a little bit about her background. I've had the great fortune of working with her on our response to the HIV/AIDS epidemic, which I hope we will continue to do after the COVID-19 response is under better control. But welcome, Jen. Thank you for being here tonight.
Thank you. Can you hear me okay? Hopefully.
Certainly can.
Great, thank you. Thank you so much for also inviting me to take part with my colleagues here in this town hall. So as Supervisor Leopold mentioned, my name is Jen Herrera. I'm the Chief of Public Health for the County of Santa Cruz. And I have previous experience, not just in public health, but in nursing. As a public health nurse, I have direct experience doing many case investigations and contact tracing, as well as coordinating vaccination clinics during a previous pandemic, the H1N1 pandemic. So I have a history of public health and of nursing, and although COVID is unique, is a very unique experience for us all. Public health is one of the divisions in the Health Services Agency through the county, and our vision is better health every day for everyone. We do this through our mission of collaborating with the community to protect, promote, and improve the health and well-being of all. And we do this with a set of core values that I'm just going to read off here. Our public health values are collaboration, community focus, compassion, equity, quality, and respect. Public health in general is a broad concept, but each county health department, also known as a local health jurisdiction, has three main focus areas of community health, and that's assessment, policy development, and assurance. And at the core of those three things are, it's driven by evidence and data and research. So using evidence and research, we use existing pandemic response research through the World Health Organization and Johns Hopkins University to develop our local response framework called Save Lives Santa Cruz County, where SAVE is an acronym for the core areas of our response. S for slowing the spread of COVID, A for adapting to new normal, V, vaccine and treatment, making sure that they're available in our community, and E is elevating readiness. And these four areas are centered around the primary goal of this entire response, which is to save lives in Santa Cruz County. Currently, per our data, our data dashboard on our website, which is updated regularly, we have 168 cases of COVID positive cases in our community, 125 of which have recovered, and 2 residents of which who have passed. We have seen a recent uptick in cases, especially over the past weekend, of which we're monitoring very closely and are assessing using epidemiological practices if we're noticing any trends. But we did note that there was an uptick this past weekend. And now I will pass the torch on to our HSA Agency Director, Mimi Hall, to talk more about updated state criteria that is guiding our response.
Thank you, Jen. As Jen Herrera said, my name is Mimi Hall. I'm the Health Services Agency Director. Health Services Agencies directors in counties have a variety of backgrounds, from sometimes social services or mental health or alcohol and drug. I am a public health practitioner by training, and I've always worked in public health. So I'm really glad that I have that perspective heading a health services agency during a pandemic. I started my career in public health in Hawaii, working in HIV/AIDS, and came to California in 1999 and have worked in California local health jurisdictions since that time. I had the fortune of first becoming a public health agency director the year that H1N1 hit. And before that, I was a bioterrorism coordinator and a pandemic influenza coordinator for counties. So it wasn't new to me, it was something that I was preparing for. So I'm so grateful that I have the right mindset and the background and the training. I currently serve as the president of the County Health Executives Association of California. That's all 61 health jurisdictions, health directors, and also fortunate to be able to advocate for what we need at the local level as things change very, very quickly at the state. And we're all getting to know each other really, really well. And I feel like the state is doing their best to work with the locals. There are always challenges. So in terms of moving forward, our community has done a great job hunkering down, being very, very compliant with our social distancing orders, but we realize that it's not without great cost and great challenges to our communities. And so on May 8th, the governor came out with a plan for reopening California, and that plan included 4 stages. At that time, we were in stage 1, which was basically where we had been for a very long time with the statewide shelter-in-place orders. Stage 2 is where we're moving through right now. And early stage 2 was open statewide. And that's where we're experiencing right now, where in early stage 2, there are these, we have the curbside pickup, we have certain essential businesses functioning. And what the governor came out with on May 8th is that counties, according to certain criteria, a lot having to do with healthcare capacity, testing capacity, contact tracing capacity, and case counts and hospitalizations, they may apply for a variance to move more quickly through stage 2. So just to give you an idea of what is within late stage 2, which is where nobody is yet, but you can apply for a variance. Late stage 2 pretty much includes 3 broad areas, which are retail, so not curbside retail, but traditional retail, dine-in restaurants, and schools, and all with modifications. And it's up to a county health officer, once we do get a variance, to move into those 3 areas of late stage 2, what our modifications will look like. I also want to mention that stage 3 includes a lot more public interacting things like movie theaters and salon visits and gyms and things like that. Stage 3 right now is off the table for the state. They're not creating any kind of avenue for locals to get to stage 3. We're only talking about moving through the end of stage 2 right now. So a week ago, variance criteria was released for counties to meet in order to apply for a variance and get an attestation approved by their Board of Supervisors. And last week we didn't meet the criteria. There are a number of areas where we still had a lot of progress to make, and they were not in our case counts or our deaths, but more in our ability to do a certain amount of testing, 1.5 tests per 10,000 per capita, or for our county, about 420 tests a day. And then the other criteria was contact tracing capacity. In all these other measures, we're doing very well in terms of working with our skilled nursing facilities to have a plan for surge and having appropriate equipment on hand to protect the workers. Another key area is hospital capacity. We have to have the capacity to surge 35% above what the hospitals are experiencing right now. So what has happened is that the state changed the criteria 2 days ago. And so they loosened the criteria in almost every area and made ORs. So you can meet the criteria one way or another. So the real thing that we had to meet was the testing criteria, which did not change, which was 1.5 tests per 10,000 residents, daily testing capacity. And with Margaret Lapiz's help, I'm really pleased to report that we have met that variance criteria, and we now have the capacity to test about 572 daily tests in the county, and we anticipate that number to continue to increase. So what does this mean for our businesses, and what does this mean in terms of reopening and getting back to some normalcy of life and helping to restore our economy? It means that on June 2nd, and a lot of people ask, why are you waiting till June 2nd? There are a number of things that happen in order to get your variance. One of those things is a consultation with the state. So we've arranged for our consultation, and we have our appointment date for that consultation. And then we have to put together all of the documentation to show the data that we actually are meeting all of the details of each area of criteria. And then after that, if our board signs the attestation, then the state reviews it. And if the state approves it, there's still another step. It doesn't mean that just on June 2nd, because the board approved it, we're reopened. What we need is then an additional health officer order, so that we have the legal authority to have things open sooner than the rest of the state. And so I anticipate that that would take maybe a week or so after approval from the state, because it's a lot of work for county council and our health officer to work on that. And I will say one area, schools with modifications, we don't even begin to understand what that might look like, and we're looking to guidance from the state. So it's possible that our health officer will have orders and modifications for dine-in restaurants and for retail, but not yet for schools. I think that that's really the gist of it. One of the things that I hope the entire community takes away is that reaching this variance is not our goal. It's just the first step. And we want to go far beyond meeting the variance. So we intend on increasing our testing capacity, increasing our contact tracing capacity, being able to really, the goal is to make our community feel assured and safe to start resuming work, to start resuming school, to start resuming normal life. And that takes a lot more work than meeting the minimum of the variance. But we really want to be supportive in getting our community as much back to a new normal as we can. Thank you. So now I'll turn it over to Margaret Lapiz. She is on loan to us from the Santa Cruz Community Foundation, and she is the director of our Save Lives Santa Cruz recovery effort. And her work has been focused, very focused on testing and contact tracing, which are two key elements of keeping our community safe as we reopen. Margaret?
Good evening, Margaret. And before you started talking, I just want to remind people that if you want to ask a question to Ms. Herrera, Ms. Hall, or Ms. Lapiz, or myself, just use the Q&A function, write it down. We're going to work to answer those questions. Sorry to interrupt you, Margaret, but good evening.
Thank you, John. Well, I've been very honored to have been asked by the Santa Cruz Community Foundation and the County Health Service Agency to lead Save Lives Santa Cruz County, which, as Jen and Mimi described, is the framework and approach we are using to guide our efforts regarding community recovery and reopening, and doing it in a safe way on behalf of all. I thought I'd just mention a bit about myself and my background. I was born and raised on the California Central Coast, a bit further south in Santa Maria in Santa Barbara County. My parents were berry growers. We actually picked strawberries on behalf of Driscoll's. I spent my summers as a child in the fields with my parents. And so as a consequence, I strongly identify with the life experience of many who live in Wattsville and the Pajaro Valley. I did my undergraduate work at UC Davis, majoring in economics. And then I matriculated to Berkeley for graduate school, where I graduated with both a master's in public health and a master's in business administration. I then began what turned out to be a 25-year career with Kaiser Permanente. 7 of those years as a member of the leadership team of the Kaiser Santa Clara Medical Center, not too far away from all of you. And then 18 years as a member of the executive team of the Permanente Medical Group, which is the largest independent medical group in the United States with 10,000 physicians about 40,000 staff, and caring for well over 4 million Kaiser Permanente members. And I had a very diverse portfolio of accountabilities during that time on the executive team, including operations, finance, technology adoption, facilities planning, and geographic expansion. And I did play an instrumental role in Kaiser Permanente's decision to enter Santa Cruz County a few years ago. Since retiring from Kaiser Permanente, and as a consequence of my selection by the Aspen Institute as a Health Innovators Fellow, I've been applying my energies to the start of a social impact organization called Under One Roof. And we are dedicated to advancing equity, health, and prosperity in agricultural communities through cross-sector collaboration and added forms of investment. And our first Under One Roof community is Watsonville, which is how I came to meet many of the leaders from across Santa Cruz. And it just turned out, given my education and experience, that I appear to be a very good fit for leading Save Lives Santa Cruz County, and I'm at a time in my life where I could say yes to this opportunity. So I'm very grateful to be here and to be working with an amazing group of colleagues, both through the county, out in the community, and through the foundation itself. I thought I'd speak a bit about my role leading Save Lives Santa Cruz County. And it's really designed to fulfill two primary objectives. The first objective is to build the critical public health infrastructure necessary to slow, contain, and stop the spread of this virus. And my main areas of focus are fivefold. Testing, which is to expand specimen collection and lab processing capacity to meet local priorities. I'll talk a bit more about the progress we've made in a few minutes. Secondly, contact tracing and case investigation. Build an approach that will meet the needs of this county. The third area is related to containment, putting in proper systems and resources for adequate isolation and quarantining. The fourth area of focus is disease surveillance, assuring that we can rapidly identify and respond to potential disease outbreaks. And fifth and final, data integration, to ensure that we have systems to enhance the sharing of data and information across many organizations and players. The second part of my role, outside of building the public health infrastructure, which is a huge accountability in and of itself. The second area is to engage a broad number of community constituents on how we can safely reopen our communities, economically, socially, culturally. And in recognition that berry season would be going into full gear earlier this month, and also in recognition that there is a disproportionate health and economic impact of this virus on communities like those in South County, I have put a lot of time since stepping into this role, and it was just a little over 2 weeks that I've been in this role. I have focused largely on assuring that I have a strong partnership model with leaders from across the South County, and I'm in regular contact and conversation with Salud para la Gente, Driscoll's, leaders from across the various community-based organizations, working together to prepare the community in a number of different ways, health education-wise, testing accessibility, and being able to successfully contain outbreak of the virus. So those are some, I just wanted to give you that big picture of what I'm being held accountable for in this particular role. I'll take a few minutes, John, if that's okay, to talk about testing.
I think people would be very interested in knowing about testing.
Okay. So our efforts to date around testing, quite honestly, have been very focused on this variance criteria that Mimi described. And that is the ability to test 1.5 per 1,000 residents. Or put differently, for Santa Cruz County, the ability to have the capacity to test a little over 2,000 individuals per week. As Mimi mentioned, we easily meet that criteria based on recent developments. We actually have the capacity to test nearly 3,000, to conduct 3,000 tests per week right now. And I thought I would just describe for you 4 distinct tracks that have guided our thinking as it relates to testing. So the first is related to symptomatic patients. For people who have a symptom, we want you tested through your medical provider. The reasons we want that done are to ensure continuity and coordination of care with your primary care physician, that it's integrated in your electronic medical record, that it's done in the context of your medical history, that it's viewed in terms of any diagnoses or ongoing conditions you may have. We know today across the care delivery system that there are 12 locations that can provide testing to symptomatic patients. So I call them the Super 7, are providing testing sites: Dignity, Sutter Pamph, Kaiser Permanente, Salud para la Gente, Santa Cruz Community Health Centers, Planned Parenthood, and the County Health Centers. All are providing testing, and you will be able to see their locations, their phone number, and the hours of operation in our new Save Lives website that will be going live soon. If you don't have a regular medical provider, you can check our website and you can get a sense by contacting each whether they are accepting new patients. And for those who don't have insurance, we would encourage you to be tested, if symptomatic, through our county health centers. One big change that I wanted to note is that we are now in a place where we are encouraging testing at early onset of symptom. So as soon as you feel you have a fever, you have cough or difficulty breathing, we want you to get tested. And that is very different from the messaging that has been out in the public over the last couple of months. That messaging was there largely because we didn't have the supplies, as many of you heard, needed on both sides, specimen collection and specimen processing. We're now at a place overall as the state to feel that we can move past some of these supply chain issues. There's still some misallocation of supplies, but they will eventually even themselves out. And so we do want folks to come in at early onset. That is the time in the disease progression that you are typically at one of the highest levels of infectiousness and when your viral load is at its highest levels. The second sort of distinct track relates to asymptomatic individuals. Individuals with no symptoms, and this is work that we want to do with critical and individuals in critical and essential roles, working in those types of jobs across the county. And that is what we are positioning the new OptumServe community testing site in Watsonville to do for us as a county. That site, which is open 5 days a week, Wednesday through Sunday, 7 a.m. to 7 p.m., is one where you need to make an appointment. You can visit lhi.care/COVID testing. Again, if you visit our Save Lives website, we'll have information on how to click on to that particular appointment registration site. That particular site, which went live 2 weeks ago, has been very busy. And I really want to thank the employers of the county for encouraging and supporting their employees to come forward and be tested. An OptumServe site can perform a little over 660 tests per week. Last week, in our first full week of operation, we had 658 appointment slots taken. We are now looking to add a similar type of site in the North County area. The third track related to testing is focused on those at very high risk. These would be individuals living and working in congregate and communal settings, those in long-term care, skilled nursing facilities, assisted living, senior living. For that distinct segment of the population, we are building a mobile specimen collection team that will be able to visit and do on-site testing in those facilities. We are aggressively moving forward to get that capability in place. So that is sort of the next big area of focus for us. And similarly, we will be tasking that same mobile specimen collection team to be the one when communicable disease investigations need to take place and large groups of individuals need to be tested rapidly, we see deploying that particular capability to assist us. So those are some of my background comments about testing. I'd be happy to take any questions along with Jen and Mimi.
Thank you, Margaret, and thank you to all my guests for their ongoing work, and we'll be ready to answer some questions. Margaret, you might want to just start off. There's a question about, are we still in need of volunteer contact tracers? Somebody has completed a course in contact tracing with Johns Hopkins, and we're wondering whether, do we have enough or do we need more?
So we're in a actually great position right now related to contact tracing, but we are encouraging folks who want to volunteer to submit their information to us through the county. We currently are in a place as a county where we need a little over 40 full-time equivalents of contact tracers. At present, by the end of this week, it's likely that we will have 35 individuals trained as contact tracers. Some of them have already are the professionals in communicable disease. Others are professionals working in the safety net clinics. But we are, through the end of this week, quite well positioned. We're currently reviewing quite a number of people in terms of them stepping forward to be trained next week. It's likely that we have another group of 30 people who we will have trained next week as contact tracers. But this is a long-term, as Mimi said, this is a long-term process potentially. And so we will be continually training and bringing people into the process of contact tracing.
And I'm not sure if this is a question for you, Margaret, or Mimi, or Jen. Employees in the public sector, the questioner asked about librarians who may not be working because their facility isn't open. Are we working to train them as contact tracers or in other positions?
So I'll take that question, John. Our plan for so contact tracing is actually a long-time public health discipline. And so what we actually have over 100 people who have volunteered that are on a list. And so our goal is to first train contact tracers that have public health training, because it's best to start with a public health workforce. And then our kind of second concentric circle or tier are those with similar kinds of backgrounds, and that's why the FQs are next. And then the next concentric circle would be people with some kind of an investigation experience. Like if you worked at the DA's office, or you're a social worker, maybe even a probation officer. So we really appreciate that folks at, lots of folks have come up, showed up from the libraries and everything. We don't anticipate that we're going to have additional paid positions for people, because some of you may know, some of you may not, that county employees, all public employees, are disaster service workers. And even some of our own county employees are underemployed right now because of the restrictions. And we're trying to get everyone back to work. So we'll start first with county employees that maybe have the right skill set, but also have a job to do, and we're trying to help fill that out. But we really appreciate everyone's interest, and we're actually brainstorming about other ways that we can use volunteers who are interested in keeping our community safe.
And I'm not sure, thank you very much for the answers. I'm not sure who's the best to answer the question. Is it possible that the latest Santa Cruz County upticks in cases has to do with our uptick in testing?
And I could answer that, and yes, it's a possibility. So at this point, it's something of note, but it's very early. It's still too early to tell what the cause and effect is, but it's as part of our public health practice, we identify things that are notable and look for trends. So it's something that we are keeping an eye on, but certainly it's potentially related to increased testing.
Great. And I just want to remind people, if you want to ask a question to these very talented professionals, you can just use the Q&A function, and we'll try to get to everyone's questions. There's been a lot of talk about the supply chain problems with testing. Margaret, how have you dealt with the question of, do we have enough reagents or enough swabs, and that supply shortage? Do we have enough to do what we want to do?
It's our sense at present that we have enough supply to meet current demand.
Great.
Demand can change, of course, with time, and we will be working through all that we will need to meet that future demand should it fall upon us.
Yeah, one of the things that I will add is counties can ask for emergency supplies through the state and federal system. And all supply chains were dried up for everybody until very recently. And so we recently received 2 weeks in a row significant supplies of swabs, which that was our limiting factor for a very long time. And so we're hopeful that as each week passes and we make our regular weekly requests from the state, that those will continue.
Great. The question came in that parents of school-age children and kids themselves are very anxious to understand what's going to happen this summer for their usual recreation activities. How are we working with recreation programs, summer camps, school district to determine how things can, how those programs can progress and what kind of programs can be offered?
So I can speak for Gail Newell on this, since we talk about this a lot, unless you want to chime in, Jen. Okay, so in terms of summer activities, actually our health officer has already allowed that. She went ahead and did that based on an error. She thought that the state had already allowed it. And so that's she's actually been working with Parks and Recreation and different groups so that following the same guidelines as childcare guidelines that have been in existence. So 12 kids, actually the state says 10. So she's got a little bit of variance from the state. I don't know if we'll get in trouble, we'll see. But the same 12 kids, so the same cohort, it can't be a different set of kids every day. And she's been working with a lot of the youth recreation programs so that they can ensure that they can start those programs while keeping kids and their families safe. As far as the schools go, I'm just going to channel what she has said. It's really, really difficult for each local county to make some decisions about schools that are different. So as recently as today, she has said her preference with schools is to wait for the state to make statewide direction and guidance. And that's actually what we've been hearing from our superintendents and our county office of education. They want something that's uniform for all the kids rather than having each district or each county be a little bit different.
Thank you. Next set of questions is going to be about this next milestone around the later stage of later parts of stage 2. A questioner has, Stephen asked, if we've seen this uptick in cases, is that a regression that might send a red flag about whether we should be moving in rapidly about reopening?
Yeah, absolutely. Actually, our health officer and our EPI team, our communicable disease unit, we're incredibly concerned. Moving forward into stage 2 is not something that gives our health officer or us any level of comfort, but we know we must do it because the community is under such financial pressure and burdens. And so the whole point about testing and hospital capacity is we know we're going to have more cases. We know we'll have more deaths. We know we'll have more illnesses, but we feel more prepared now than we did 4 weeks ago or 8 weeks ago to handle it in terms of healthcare capacity and testing capacity and all of those things. It's always going to be this balance between keeping the community safe and trying to make sure that people can get back out there and earn a living and do it as safely as possible. But there could be a point where we have a surge large enough to near the surge in the capacity of our hospitals, and we will have to walk things back.
Sure. And someone asked, this is a question I get a lot, and about are we looking at the impact on the economy to make our decisions? Given our low counts, there's a questioning of are we making a choice on one metric but not the other?
No. Yeah.
There's other things I could say, but I'll let you take a first shot at it.
Okay, I'll take a first shot at that. So what drives our decisions? Public health data always drives our decisions. And I believe that the reason we have low case counts and we have few deaths is because of the quick public health action we took early on. However, we cannot do anything more permissive than the state. So a lot of people think that our health officer is being very draconian, but we are not permitted to. So for example, the things that are not permitted in stage 2, even if we do get a variance, the variance only gets us those 3 things: retail, school, and dining restaurants. That's it. So the things that are not permitted, because the state hasn't allowed any county to go there, are personal services, gyms, museums, public pools, playgrounds, nightclubs, concert venues, festivals, theme parks. All of those things are off the table, and we understand what the issues are and the challenges, especially with summer coming up and our reliance on tourism, but we don't make those decisions, the state does. And so the state has made this exception to allow us to apply for that variance for those 3 areas for the rest of stage 2.
Yeah, I think that's very widely misunderstood about what power people assume we have because we acted early, and then what power now we have to follow the state's rules. And appreciate the work that that Margaret's doing, Jen and Mimi are doing to help us get to that place, to make sure that we can do it as quickly and safely as possible. So there's a question of sort of what happens on June 2nd. What changes could we expect? What the board votes, assuming we vote in favor of this variance language. What will happen then? You talked about it a little at the beginning, but maybe you could share a little bit more information.
Sure. So if the state or if the board approves this on June 2nd, it doesn't mean that evening we're all going out to dinner. So what would happen is the board would approve it. We would then send our application to the state. And then the state has some time to review it. The review, I've been looking at when other counties have submitted theirs and then when they get approved, and it's been about a week. But just because the state approves it doesn't mean we're open. We still have to have modified health officer orders defining what is open and what is not in what capacity. And again, it's only in those 3 areas: retail, restaurants, and schools. And Gail has already said she could change her mind, but she's already said she's not ready to talk about schools. So it's likely that she will only address retail and restaurants in her modified orders after June 2nd and after the state approves.
And I know she's been in regular contact with the superintendents and meeting with them to share information. There's a two-way conversation going on there.
Yeah.
Margaret, I'm wondering if you could speak about the partnership with UCSC, their testing capabilities, and what role the university might play, especially when the campus, if and when the campus invites students back.
Yeah, we had a great meeting between the County Health Services Agency leaders and the university leaders from across the campus were present. As you may have heard or read, they have been approved to have a CLIA lab, and they are slowly ramping up their operations, working with Santa Cruz Community Health to identify all of the operational workflows associated with performing the specimen processing associated in the lab testing process. So we are planning on engaging with them to see what unique role they can play for us. We are particularly interested in seeing if they can support the mobile specimen collection team work that we want to advance as being the preferred lab to support that. We're also interested in having them be the lab that can perform at a level of turnaround time for results that is better than what we can obtain today from any of the clinical labs that various healthcare organizations are using.
Yeah, they could be a great partner, and especially for them to build capacity. If they're going to invite students back, that'll have a big impact, having all those people come from all those other places. Right. I'm wondering if you could talk about what kind of work, this might be for Margaret or Jen, what kind of work you're expecting from volunteers who are looking for contacts. Are they going to be moving around the county? Do they do it from home? Do they call people on the phone? What does a contact tracer do, really?
Yes.
I can start. Is that okay, Margaret?
Please, Jen, go.
Just to give an overview of how it works with contact tracing, because contact tracing is just one piece of the whole disease investigation. Because getting a positive COVID-19 diagnosis, that's reportable by law to a health department. And once we receive that notification, which is immediate from the lab, we have a goal at public health to respond to that case within 24 hours. And what that means is to conduct an initial investigation of the person who tested positive. And after that initial investigation, we'll have a better sense of who their close contacts were, where they may have exposed others, where they may have contracted the virus. And then the next step is to start doing contact tracing, of reaching out to the close contacts associated with that case, that person who tested positive, and determining their level of risk, encouraging testing for them, helping them, linking them to services, or answering their questions to ensure they have access to care, and then determining once their results come in, if it's positive, then continuing that pattern of doing more contact investigation and case investigation and contact tracing. So I wanted to just paint that picture of to let everyone know that contact tracing is vital and a core component of what public health typically does, especially through our communicable disease unit. But it is just it doesn't exist in a vacuum. It's done in conjunction, in partnership with public health and our local disease investigators and public health nurses and epidemiologists. So it's a team approach. And so what we would expect from this contact tracing workforce is a coordinated approach or coordination with the local health department. And I think at this time, we are figuring out right now what is going to be the best mode. It's likely that there will be a portion of it that can be done remotely as well as on site. And we're looking at various options to ensure that contact tracing does not create a barrier to our disease investigation and containment strategies. And Margaret, I don't know, would you like to share more about our plan for expanding contact tracing?
Sure. I mean, I do think that the design that we are employing is one that is high touch, high trust. So it is one that is extensive in terms of a lot of time talking with individuals about where they've been and who they've been in contact with over a most recent period of their lives. It's work that we really want to be able to have skilled expertise in. We want to build that skill in the people who perform this on behalf of the county. The current training that has been identified for the state involves an online academy, and it's 20 hours of training of upfront investment in one becoming a contact tracer. Now, if you're an individual though, with a healthcare background, and we have some volunteers who are retired physicians and nurses, social workers who have much of the patient communication skills needed, I think, to be effective as an investigator or contact tracer. For those individuals, we're likely to use a program like the Johns Hopkins program, potentially, but still we do want to have some level of consistency around our team that we can really invest in their skill and expertise to play this very important role on behalf of the safety of our county.
Sure, and with any kind of contact tracing, whether it be in person or there's some places are talking about some kind of phone app, how do we protect the privacy of the people who are being interviewed and their contacts? What are we doing around that?
Jen, do you want to describe how the process works today?
Yeah. So how we're protecting the private health information of everyone. One of the core trainings that is required of anyone in public health, including the contact tracers, whether they're paid or volunteer, is a training in HIPAA, which is basically it's understanding the laws that protect protected health information, or PHI. And it's not just it's a review of what you have access to, as well as how you disclose and how you ask for permission to disclose protected health information. So that is part of our general workforce training and part of any healthcare worker training. And then the platform that we'll be using is likely we're exploring options right now, but thankfully in the state of California, we have a statewide application that would be available for us and would meet all of those protected health information criteria.
Yeah, well, I think it's going to be very important, and depending on the individual, being able to share information about who they've been in contact with becomes very important, and having well-trained contact tracers who can relate about how we're going to keep information private will be very important to the success of the tracing campaign. We have a couple minutes left. I want to try to get to the final questions. John D. asked that there are 60 Watsonville cases out of the 168 total. I wasn't familiar with that, but she's wondering if it's because of a particular industry or family or connections, or could it be related to zinc deficiency, which she read about in a study in New York. Is that, have we been able to determine any of that kind of information from the number of cases that we've had?
That is something that, just in full transparency, I'm not quite ready to answer right now on this forum, but it is something that our epidemiologists are looking at, and we actually have daily consultation with Dr. Gail Newell to determine what trends are happening, if there are emerging clusters. Right now, we do not have anything defined as an outbreak in South County, but there could be associated cases that are associated with each other. So at this point, it is information that we have posted publicly on our dashboard, but not quite ready to provide intelligence to that yet.
Right. So we're still studying it, is really what it comes down to. Well, I'll ask this final question. When the state prepares us to move to stage 3, which will include hotels, vacation rentals, people started returning to come to our community. Do we see that happening here in Santa Cruz? Will we be open to hotels and vacation rentals opening again when we move to stage 3?
I believe that's dependent on the state's criteria of stage 3, and I don't have it right in front of me, but Mimi.
I have it in front of, so it could be in stage 3. They're not, it's definitely not permitted in stage 2, but it's a possibility in stage 3. And again, I'll try to channel our health officer. One of the things that's highly concerning of her, and one of the ways that this disease transmits, it's when new cohorts of people that aren't normally interacting with each other interact.
Sure.
And so with tourism, we've got folks coming from all over the place, and it's really, really concerning to her. I don't know exactly what she will do, and I don't think she does at this point either, but just so the public knows that while we do want a robust economy, we're always balancing that with safety, and it's something that she's looking at.
I know that I hear from constituents, and half of them say we want this business back. It's important for livelihood, and the other half that say I'm very worried about people coming from other places who don't have the same numbers as we have. So we place a great burden on the shoulders of our health leaders and the board to try to make the best decision possible to protect the safety of residents and make sure that we're doing what we can to both protect the public health and also allow people to earn a living and make it here in Santa Cruz, because we know this is not an inexpensive place to live. I want to thank the three of you for joining me this evening. Margaret, welcome to working with the County of Santa Cruz. I look forward to your work. You're playing a really incredible role, a critical role. Jen, for your ongoing work in dealing with public health means that you deal with lots of difficult issues, sometimes controversial, but you've always kept a really good focus on good public health to drive those decisions. And Mimi, for your ongoing work, we couldn't have a better person in that spot right now to lead us during this difficult time. I hope people who've joined us tonight have appreciated this new format for the meetings. Continue to work to try to find the best way to keep in connection with you, share information about this pandemic, but also share information about what's going on in the district and in the county. Next Wednesday, we'll be talking, not COVID related, but we'll be talking about this temporary housing. I guess it is COVID related to this temporary program in SoCal, and we'll have the Community Advisory Board joining us. So thank you very much for being here this evening. We've recorded this, and we might find a way to post it to my Facebook site. but I appreciate the work that everyone does every day, and thank you for joining us this evening.
Thank you.
Thank you, John.